So can they see it and we just can't?
Yes, the viewers can see it. Okay, it's up there. Stop. Okay, it's done. So we can.
That's already definitely.
Have you recorded?
It's not recorded.
Yeah.
You talking about?
Yeah, I think so.
It's just too much.
Oh, is it just you?
Yeah. Yeah.
You're talking about it. Good morning, everyone, for our monthly journal club. So this morning we have Laura Hardefeldt, who has been one of our most hyperactive PhD fellows. She's done a huge amount of work and really starting to make herself known nationally in some of the work in the opportunities for antimicrobial stewardship in animal health. So without further ado, Laura, our next big challenge.
Thanks, Kaz. So this is the results of some work I did last year looking at antimicrobials for surgical prophylaxis by vets. And just some background, there's been only one or two other studies looking at antimicrobial prescribing in the veterinary profession in Australia. There was one that was done in 2011 and it looked at a range of medical and only 2 surgical scenarios, and that I wrote up the result. I got given that data set and wrote up the results last year as well. And then there was only 1 or 2 that were done in kind of the late 1990s, early 2000s, and were very small studies. And so we were interested in quite detailed prescribing data, and so we chose surgical prophylaxis because we figured that most people would be using the same drugs, and it gave us an opportunity to look at quite detailed prescribing. So that's why we chose surgical prophylaxis. So just as an introduction, I'm sure everyone's seen this picture before, but it's infographic, but antimicrobial resistance is a looming global health emergency, and as the threat of antimicrobial resistance becomes increasingly clear, the focus on veterinary use of antimicrobials has been increasing as well. So there are some guidelines for antimicrobial use in veterinary practice. The ADAP guidelines were produced and sponsored by a pharmaceutical company, and they came out in 2013. There has been some reservations by the profession for the fact that they are pharmaceutical sponsored, and I think their use has been restricted because of that. And the British Small Animal Association, Veterinary Association, released the Protect guidelines, which cover a little more broad and cover surgical prophylaxis a little more fully. For large animal guidelines, the British Equine Vet Association also produces some guidelines for use of antimicrobials in equine patients in the form of the Protect Me guidelines, and they're the only ones that are available to date. And similarly, for cattle, there's no prescribing guidelines globally that have been released. So the aims of this project were to investigate detailed antimicrobial use for surgical prophylaxis in companion animal, equine and cattle practice, to assess appropriateness of dosage and timing of common antimicrobials across the species, and to assess compliance of companion animal and equine veterinarians with the existing guidelines. Of course, we couldn't look at the bovine veterinarians because there were no guidelines at the time. So it was a cross-sectional study using an online questionnaire. It had 4 main areas. We looked at the demographics of the respondents, the frequency with which they used antimicrobials for specific surgical scenarios, and we asked them the dose, the timing and the duration of therapy, as well as the drug that they used. We asked them about practice antimicrobial use policies and sources of information about antimicrobial drugs and their uses. We recruited participants at all of the major veterinary conferences last year, using social media and using a variety of e-newsletters. We did a sample size analysis to ensure that we could make appropriate inferences from the survey, and we calculated that we'd need 384 completed surveys. We did descriptive stats. We adjusted the stats using sampling weights because the proportion of veterinarians responding from different states varied. And then we used a binary logistic regression model to interrogate our individual veterinarian level characteristics that influence the prescribing. We set our significance at p less than 0.05, and it was approved by the University of Melbourne's Human Ethics Advisory Group. So we had 889 responses to the survey. The demographics broadly reflected those of the Australian veterinary population. Predominantly, our practitioners were either small animal practitioners or mixed, or that we did have a few that were doing just large animals, either bovine, equine, or both bovine and equine. Very few of them had an antimicrobial use policy in place, only 23%. So we asked about the frequency of antimicrobial use. We asked them, and they selected whether they always, frequently, sometimes, rarely, or never prescribed antimicrobials in that scenario. So in this graph, the scenarios are on the x-axis and the percent of responses are on the y-axis. We've grouped always and frequently in the green section of the bar, sometimes and rarely in the red, and never in the blue. So for companion animal surgery, for our more routine surgeries, which are these four on the right-hand side, we can see that practitioners never used antimicrobials around 50 to 60% of the time, but we did have quite significant percentages that were always or frequently using antimicrobials. For the more invasive surgeries, here on the left-hand side, practitioners almost always or frequently used antimicrobials. For equine surgeries, the graphs are the same with the scenarios on the x-axis. We can see that practitioners more frequently always or frequently used antimicrobials in these scenarios. There was really only two where there was less use of antimicrobials, so a clean wound and a dermal mass removal. When we looked at the cattle scenarios, there was more use of antimicrobials, with more than 80% of practitioners in all scenarios indicating that they would always or frequently use antimicrobials. If we look at the classes of antimicrobials used, the beta-lactams and the first and second generation cephalosporins were the most commonly used antimicrobial classes in companion animal practice. And that was across all scenarios where beta-lactams were first and second generation cephalosporins were second, except in the dental scenario where the macrolides came in second. There was very low use of third generation cephalosporins, with cefavecin, a long-acting third generation cephalosporin, the only critically important antimicrobial mentioned in the survey, and that was most commonly again in the dental scenario. In the equine scenarios, the penicillins, predominantly procaine penicillin, was by far and away the most frequently used antimicrobial. There was some long-acting penicillin use, and some trimethoprim sulfa and gentamicin was also used. And similarly in the cattle, penicillin and oxytetracycline were the predominant antimicrobials used. They were predominantly the short-acting and narrow-spectrum procaine penicillin, but there was some long-acting use of antimicrobials in both of those classes. We look at compliance with the guidelines. We assess compliance as optimal or suboptimal. So we define optimal compliance as complying with all parts of the guidelines, whereas suboptimal compliance was defined as choosing the right drug but getting some other part of the compliance wrong. So you can see for the routine procedures on the right-hand side here, there is no suboptimal compliance, and that was because antimicrobials were not indicated in those scenarios. Our compliance rate is the same as our never used antimicrobials. But for our more invasive surgeries where antimicrobials were indicated, we had pretty poor optimal compliance, but reasonable suboptimal compliance. So vets were choosing the correct antibiotic, but they were getting something else about the prescribing incorrect. And if we dig into that a little bit deeper, this graph shows the compliance with the drug in blue, the timing and route of administration in red, and the duration of therapy in green. We can see that, as with suboptimal compliance, our choice of drug was quite good, but the timing and the route of administration mostly did not allow for tissue concentrations at the time of surgery, and the duration of therapy was uniformly too long in these scenarios. It was never too short, with about 30 to 40% of the respondents only giving antimicrobials for the recommended duration. Similarly, with the equine scenarios, antimicrobials were recommended in more of these scenarios. So the only one where they weren't recommended was in a contaminated wound that was not sutured and not infected, and vets almost always used antibiotics in those scenarios, and so optimal compliance was very poor for that scenario. And it wasn't really great for any of the others apart from the dermal mass removal, but again, suboptimal compliance was pretty good. So vets were choosing the right drug. And if we look into this a little bit further, unfortunately, I'm sorry, but this graph is the other way around. So on the y-axis, it's the percent of responses that were inappropriate, and timing is in blue, dose is in red, and duration is in green. So for almost all of the scenarios, all three parts of these guidelines were followed quite poorly. So vets often got the time wrong, they often got the dose wrong, and the duration of therapy again was often too long. Although the duration of therapy is probably the one that's been done best of all of these three. We couldn't look at compliance with the guidelines with cattle, but we did look a little bit into the appropriateness of use in cattle. So the graph on the left is the dose for the two most commonly used drugs, penicillin, procaine penicillin and oxytetracycline. We can see that more than around 90% of the respondents were using a lower dose than recommended for procaine penicillin, and around 50% were using a lower dose than recommended. 60% were using a lower dose than recommended for oxytetracycline. We asked about timing of therapy for cattle, and almost half of our respondents were giving antimicrobials after surgery, which clearly won't result in antimicrobial tissue concentrations at the time of surgery. And we asked about duration of therapy for cattle, and the most common responses were 1 to 3 days and 4 to 7 days. So clearly often longer than required as well. And there's quite a bit of previous research to show that cattle do just fine with less than 24 hours for many of the surgical procedures that we asked about, including repair of an umbilical hernia, repair of an exploratory laparotomy for a cecal torsion, and for rumonotomy. So quite invasive procedures that vets in this survey almost always used antibiotics for. So in our multivariable logistic regression model for the companion animal scenarios, our companion animal only veterinarians had a almost 40% higher odds of compliance with the guidelines compared to mixed animal practitioners. Surprisingly, our graduates who graduated in the last 5 years, which is what we defined our recent graduates as, were 25%, had a 25% lower odds of compliance with the guidelines. I'll talk a little bit more about that later on. And our practitioners who came from the larger practices had a 43% higher odds of compliance compared to vets from smaller practices. There was no significant effect of having postgraduate qualifications, having an antimicrobial use policy, or having ready access to the guidelines. For the equine model, university vets were 3.2 times higher odds of compliance compared to general practitioners, and there was a trend towards a 40% lower odds of compliance in the new grads compared to the older grads, similar to the companion animal survey. We couldn't do this with the cattle vets because we didn't have compliance as our outcome. So if we look at what optimal compliance is broken down to, it really is the antimicrobial selection, the dose, the timing, and the duration of therapy. And our antimicrobial selection across all three species was pretty good. We had 68 to 92% choosing the appropriate drug for the scenarios. There was quite a bit of long-acting penicillin use in both cattle and equine surgical scenarios, and there's quite good evidence that particularly for long-acting penicillin compared to long-acting oxytetracycline, that serum concentrations are not maintained above MIC for common equine or bovine pathogens. And there was quite a bit of gentamicin use in the equine scenarios. That's illegal in cattle, so it's not used in cattle, but in the equine scenarios, gentamicin in Australia is labelled do not use unless susceptibility testing has shown that it's the only drug available, and that's a legally binding clause in many jurisdictions in Australia, including in Victoria. But if people are using it for surgical prophylaxis, that clearly can't be met. But it is appropriate. It is in the guidelines as an appropriate drug for surgical prophylaxis, and it's one that we've put into our guidelines. And I think that we need to lobby for updates to the labelling legislation, because if that was to become enforced and vets were pushed to use other drugs, there's pretty limited options for gram-negative coverage in equine medicine, and it would push them towards drugs that have higher importance rating, like the fluoroquinolones or the third-generation cephalosporins. In terms of the dose, this was pretty well done in companion animal practice, but pretty poorly done in large animal practice. In large animal practice, vets were rarely using a dose that would result in tissue levels above MIC for common equine pathogens. And again, this labelling might be an issue here. The labelled dose of procaine penicillin, both for cattle and for horses, is well below almost half that's recommended in the literature for those species. Although the dose on the gentamicin bottle is also wrong, and so labelling, and yet most of our practitioners were using the appropriate dose of gentamicin. So it's clearly not the only issue that's leading to underdosing, but I think it is contributing. And similarly in companion animals, the dose on some of the older antimicrobials that are commonly used, like amoxicillin and amoxicillin clavulanate, is well below that's now recommended, and yet vets were using an appropriate dose. The timing of administration was pretty poorly done across all species, with only 14 to 17% of veterinarians administering antimicrobials at a time and route that would allow for tissue concentrations at the time of surgery. And I think this is an education thing, that hasn't got out there yet, that you really need to have tissue levels at the time of surgery to prevent surgical site infections, and the cattle vets were definitely not aware of that. So, and then the duration of therapy was okay in some scenarios, but poorly done in others, and antimicrobials were, when it was not compliant with the guidelines, were always administered for longer than the recommended duration. If you look at the individual level factors for companion animal vets, and vets from larger practices were more compliant. We think this might be because they have a greater access to continuing education. There's more continuing education for companion animal practitioners. Often they're located in metropolitan areas, and so they might have easier access to to continuing education, and they often come from bigger practices, and so there's more access. If you come from a practice with 6 vets, it's easier for one to go to a conference than if you come from a practice with 2 vets, and you're just leaving one person at home to look after all the patients. So, and then there's, when you have people going to conferences, there's more knowledge sharing. If you've got 6 people going to conferences every year rather than just 1 or 2 people going, then there's more opportunity for that knowledge sharing to occur. In terms of why our recent grads were less compliant, it certainly could be that there's poor university teaching, and we're running a survey this semester looking at the knowledge and attitudes of our students to antimicrobial resistance and antimicrobial stewardship. We think this is unlikely, and certainly in the equine scenario, our university vets had almost 3.5 times higher odds of compliance than general practitioners. So it's probably got to do with peer pressure and lack of confidence, and I think this fear of something going wrong in those particularly first few years after graduation, when young vets are out there on their own and just worried that if they don't put it on antibiotics, then it might all come crashing down. So in conclusion, I think all vet clinics need to establish antimicrobial stewardship processes. We do need an education campaign to target appropriate timing and duration of antimicrobials and the non-use of antimicrobials for routine clean surgeries. And we need to lobby for changes to regulation on the labelling of antimicrobials, because it's not just that it is giving vets the wrong information right in front of them, but also when you come to food animal producing species where the withholding periods are also on the label. If you go off label, then you're responsible for giving the farmer a guide to the withholding periods that they need to follow. And so that's definitely a barrier to using an appropriate dose in that scenario. So I'd like to thank everyone who completed the survey last year. The ABA, Australian Veterinary Association and Agriculture Victoria have partnered with us on much of this work. My supervisors and collaborators and the funding sources. Happy to answer any questions. Helen.
Hi, Laura. For the people in the room probably unaware that most of our large animal work, surgical work, is done outside.
Yes.
Yep. So do you have any comment, did you ask that question about whether there was a difference between where the surgery was done in a sterile environment versus?
Yeah, we did. We asked them.
Just repeat the question.
Oh, yeah. So Helen just asked if we, given that a lot of large animal surgery is done outside, if we ask vets about what influenced their use of antimicrobials in different scenarios. And we did ask them and what influenced their decision to use antibiotics, and the surgical conditions were noted by about 25% of practitioners as influencing them. But it's interesting, the trials that have been done looking at antimicrobial prophylaxis for bovine surgery have not been done in sterile scenarios. So the one looking at umbilical hernia repairs was done in the field. It wasn't done outside on a dusty, dirty day. It was done in a clean shed, but I think that's usually how umbilical, certainly at the practices I've worked at, that's how umbilical hernia repairs are done in calves. They're not brought into the hospital, but they're also not done, people aren't stupid about doing surgery in a dust bowl. So, and those in that survey looking at in that trial looking at using antimicrobials for less than 24 hours versus 7 days, there was no difference in the surgical site infections in those calves. So, and similarly for the other trials that were done, they weren't done in sterile environments. They were done in the real world, but not in the stupid world. So, yeah, Kaz.
For those of us who work in tertiary hospitals with, theatres of laminal flow and projectile, can you step us through, as an equine vet, how you would do an operation in the field, what you do about personal protection, how you prepare the operative site, just for us, because it's hard for us to imagine what it's really like.
So I'd say it's not too different between equine surgery and bovine surgery. So usually for bovine surgery, the procedure is done with the cow standing. 99.5% of the time the cow would be standing for surgery. And so they're restrained in a set of stocks, in a crush, and they're clipped and prepped as you guys would clip and prep for a surgical procedure. But it's all done under local anaesthetic, obviously. We very rarely use drapes, but the vets would rarely wear a gown, but they have overalls on and sterile length gloves and sterile gloves. So for a bovine surgery and similarly for an equine surgery, really, although more cows are much tougher than horses in general, so most of the abdominal surgeries in horses would be referred to a referral hospital, and then they'd be done in very similar, very clean surgical suites. But for stitching up a wound or doing a castration, they're done in the field, usually under general anaesthesia because horses are a little bit more dangerous than cattle. So done in the field. The owners are usually
And skin prep?
Yep, skin prep.
Floor hex?
Yep, floor hex usually. Yep. You have to be fast in horses because you can't anaesthetise them for a huge amount of time. So 15, 20 minutes would be kind of, maybe half an hour would be the most that you would do in the field for equine surgery.
Rod, did you want to comment on comparing and contrasting these figures to what we're finding in the hospital setting? They're quite similar, aren't they, in a way?
The similar problem, especially in the hospital setting, is duration, which is the main problem. Where here duration seems to be one of the least problem. We get the dose right a lot more of the time, and it's more about just prescribing too long or in indications where it's not required. So
yeah, I think there's limited resources for vets to know what the appropriate dose is. There's not a drug formulary. There's the MIMS, but the MIMS just has the label dose. It doesn't have the appropriate dose in it, and so it is actually really difficult for vets to find that sort of information. And I think, which is probably the case in medicine as well, there's not a great understanding of pharmacology of antimicrobials and how to use that to formulate an appropriate dose. Plus, there's not, it's really hard to find MICs for common pathogens for any of the species. So it makes it really difficult for people to, do that well, I think.
So, Laura, while you're at the podium, perhaps you might want to then sort of touch base on some of the qualitative findings that you've had. It's a good chance to everyone here. We had Leslie's 2-year confirmation yesterday, which had pretty extraordinary, and your comment about the fear factor clearly comes out of nursing staff in aged care. So, perhaps if you've got some time, because we don't have a second speaker today, comment on some of the qualitative.
Yeah, so we followed this up with a qualitative study looking at the enablers to and the barriers of stewardship. It's a mixed method study. We did a survey as well, and we investigated some of these factors a little more in a little more depth, and certainly people acknowledge that the fear factor is really driving inappropriate use, and also probably some of the things that GPs also encounter as well with patients' demands for antimicrobials. But there's some other factors that really play a role in veterinary practice. These are small businesses, usually with pretty small turnovers, and people are, particularly in large animal practice where some of the farms are quite big and bring in a lot of income, feel under quite a lot of pressure to prescribe antimicrobials if their clients want them, because they're worried if they don't do it then they'll take their business down the road to the next practice, and that could have quite a significant impact on their business, especially some of the equine practices. A stud farm might have 1,000 horses on it. That might be as much as a quarter, or not a quarter, a sixth or an eighth of their business. So, and for the dairy practices, it's the same as well. So that has a huge influence as well. But yeah, lack of resources, lack of education, not knowing where to start, were all pretty common things that we encountered. Yeah.
So do you have any idea? I'm from the human side, so I don't know this information. Do you have any idea about post-surgery infection rates and whether they correlate with appropriateness or not appropriateness?
Yeah. So there's been quite. So just asking whether there's surgical site infection rates published and whether they correlate with antimicrobial use. And there's actually quite a lot in the literature about surgical site infection rates. Many of the published studies are done in university hospitals, which is not the real world, but there's still quite a few that are done in general practice settings. And surgery rates are, for routine clean surgeries, range between 2 and 5%. For clean contaminated, they're between 5 and 10%. So, and there's not much in literature about contaminated surgeries, but it's not, the rates aren't huge, and where they have looked at short duration of prophylaxis versus longer duration, there's been very few studies that have shown that the long duration is required for routine clean procedures. In fact, none. But there are specific, attributes of small animal surgery and large animal surgery where they have shown that you need longer duration prophylaxis. So for if you're using or putting in a plate or a pin in small animals, then there's only one study looking at it, but 7 days significantly reduced the surgical site infection rate compared to 1 or 3 days of therapy. For obese dogs, for dogs undergoing surgery for more than 90 minutes, then we probably need to, instead of just using one preoperative dose, probably need to go for that first 24 hours. So there are some pretty well-defined mitigating factors that you need to consider when choosing whether to just do preoperative or continue for that 24 hours. But so there is a bit of research in this field to guide guidelines and guide use. Cool.
Thanks very much, Laura, and I apologise we don't have a second speaker today because Helen was unable to do it, but we will be back in force. And Arjun, who's next up? Do you have the...
Nolly, Fiona and Deb.
Oh, great. We have a trio. Yep. So Nolan Bennett, Deb Friedman and Fiona Goddison, who's our latest addition to our team, who is undertaking a nursing led AMS. Okay, thanks everyone.